right. Hello everybody there in Facebook land. This is Dr. Lynn at Turning Point Chiropractic, and thanks to you guys for being here in the lobby. It's awesome to have you here. This is a class that we actually offered last year, and unfortunately, I was not able to attend it. I'm so looking forward to this now because it is absolutely one of the most critical things you can do as part of your chiropractic lifestyle is make sure that you actually have your movement habits and patterns in such a way that you're promoting better function and better health. And so, one thing we know for sure, guys, is actually that most of the things that are killing us now are not these illnesses that pass like through pandemics. They do happen now and then, and we have all been through one. But even in those situations, the people who are actually most fit and most healthy going into those things fared far better than those who did not. And so, just to give you an idea, that I'll just quote one study, and then I'm going to turn the forward to our speaker. In South Korea, they were doing a study on exercise. They were looking at what effect it had on people's health, and it was actually being done before the pandemic hit. And when the pandemic hit, they said, "Should we stop the study?" And they said, "No, no, keep it up because we want to see really what happens to people when they've been actually exercising." So there was a critical point at which, like going down the list of activity from here to here to here to eventually none, that you could see where people really had a major uptick in their health outcomes when they were more active. And actually, the group that did the best were those who exercised 150 minutes a week. So you'll do the math and say, well, that's 5 times a week for 30 minutes. That's not a huge commitment. But those who actually were participating in some type of moderate exercise at that level saw their getting sick from COVID, and first of all, significantly reduced. Those who got sick enough to actually go to the hospital were significantly reduced, and those who actually eventually needed ultra like severe care, like ventilation, that went down. And then those who died, it was way less. So basically, what I'm saying to you is, you guys need to be thinking about preparation. There's no time like the present to make a change when it's not screaming at you, shall we say, right? So I want to be sure that you guys have the why, and when you really know what your heart's desires do things, I find that often the what and how take care of themselves. And Laura's going to cover those things for us as well too, because she's a certified instructor. And if what she has to offer you is something you say, hey, I want to be part of that, then please do it. If it's something you say, well, is there something like that? Maybe more in my end of town or wherever you go or the time of day. Let's not let those practical things be barriers to you that we will help you any way we can do it. So I'm going to turn the floor over to Laura Carlene. She's actually here. I met her at church about 3 years ago. Found out all this cool stuff she does on top of her ministry things, and she will be glad to share with you her wisdom in terms of how exercise benefits both your brain and your body. So let's give her a nice warm up, and there you go. Yes.
Thanks, Dr. Lynn.
You're so welcome.
Yep. So like Dr. Lynn said, my name is Laura. I am a certified group fitness instructor and have, had my own journey with trying to incorporate physical activity and exercise into my life. And it's something that I feel passionate and excited about, not because I'm like, oh, I'm trying to go out and win a CrossFit competition or something. Like, I'm not like an athlete. But I have experienced a lot of the benefits of being a physically active person, and that I've definitely been on a journey with that. And so I'm just excited to share and hopefully get you excited about some of the benefits that having a physically active lifestyle can give to you. So I am going to start with this question, and is it okay to invite audience participation, Brenda? Yeah? Okay. Let's see. So this question that I'm going to start with is, why is it so hard to make regular exercise a part of our lives or your life? You can answer for yourself, or you can just answer for kind of what you think popular public opinion might be. Injuries. Yeah. If something hurts, you're not going to want to get out and walk or get on the elliptical at the gym. Work. What makes work make exercise hard? Yeah, lots of people spend lots of time at work. Yep. Other things? Okay. Other activities. Yeah, just time in general. So like, even if you're only working a job, it's already hard to incorporate, physical activity. But then adding, if you have kids or a family or roommates or any other thing outside of your job or your school, that's going to add extra blocks of time that, are unavailable to do something physically active. Any others that you can think of?
I thought of like, well, now I'm not but sometimes it's going by yourself. Like, and I've encouraged like my own family, like, come with me, and I want to come, but I think sometimes I feel like sometimes that's a barrier.
Yes. Yeah. So if you couldn't hear that, going by yourself makes it really hard, especially going to the gym, or if you're trying to go out on a walk, you would rather be with somebody maybe and have a buddy to do it with compared to doing it in isolation, especially if you're an extrovert. I could see that definitely being a factor. Well, I think there are a lot of them, and we probably can't exhaust them in our short amount of time. I think, yeah, the time and energy thing is a big one. So not just time, but like just physical amount of energy that at the end of a long day, it's hard to then either go straight to the gym or to get home and you just want to relax and do nothing, but then to like change your clothes and either get outside for a walk or to head to the gym to lift weights. Like, yeah, there's just an internal sense of like, I just do not have the energy to do that at the end of a long day or the end of a long week, maybe. Um, I think oftentimes the benefit of being active is only tied to weight loss. And so if you're like, well, I don't really want or need to think about losing weight. And so if you're like, well, if I don't need to lose weight, then I don't need to go work out. And so I think, or, we have a different, of lots of people, this could be a whole other talk actually that you could do of our relationship with our bodies and how we look and how much value, unfortunately, is tied to that. And so if you're on a day where you're just like, I don't care, then maybe weight loss isn't enough to motivate you to the gym. Um, and then also, it's not an instant gratification type of experience. That the way that I've kind of started to think about exercise is like the experience of saving for retirement or like paying your car insurance. That's money that's not going into your budget to spend on things like food or fun stuff that you can do in a month. It's you blocking off energy and fun for later, and you're just feeling the sacrifice of it now, except for the fact that once you have that money saved or once you have that car insurance policy that you've been paying, you get to draw on it when you really need it. And so the idea of it not being fun in the moment or on the day is actually quite fruitful in the long term, but it's not an instant gratification type of experience. And sometimes we feel like everything else in our life might not involve instant gratification. So I just want this one night to sit and watch TV and not think about anything. That feels good. So I wanted to start by talking through some of the barriers because those are legitimate things. And I think sometimes we could go through a talk like this and act as though all of these reasons should just motivate us out the door and there aren't any difficulties then to incorporating activity into our lives. But I don't think that's true. All of the things that we've listed and more, yeah, are incredibly significant to factor in when we're trying to think about how to be regularly physically active. So my goal today is just to offer you a wide range of ways that exercise can benefit your life in the hopes that it just slightly increases your motivation levels. And at the very end, we'll talk about some practical ways that you can start increasing your level of physical activity. So this hopefully can just go into that well of motivation and the good things that you can think about when you're trying to get in your car to head out to walk around Holmes Lake or do whatever it is that you're planning to do. I'll also say I'm going to throw a lot of information at you. I would just say maybe choose one or two things that really interest you and are compelling to you. And I'd invite you to like look into them on your own because I'm not going to go very deep into any of these benefits. So if there's something that's on your mind, jot it down and then do some research using Google on your own. All of that is at your fingertips to research further. So the first thing I'm going to talk about is the benefits of exercise for your brain. And again, there are a lot, but these are just the few that I'm going to touch on, is that it can have physical and physiological effects for your brain, not just your muscles, your brain. It can have cognitive benefits in regards to dementia and Alzheimer's, and exercise and regular physical activity can impact your mental health in positive ways. So starting with physical and physiological benefits for your brain. The same way that you could expect to see like musculature improvements or musculature strength, or you just feel physically better in your body the more active you are, your brain also will experience physiological changes to the actual stuff, the actual matter that makes up your brain will change as you implement an exercise routine. So a quote here from Scientific American says that exercise has the ability to reduce insulin resistance, reduce inflammation, to stimulate the release of growth factors, chemicals in the brain that affect the health of brain cells, the growth of new blood vessels in the brain, and even the creation, number, and survival of new brain cells. And I thought this was important enough to put it up on the board as well. Exercise increases the creation of mitochondria, the cellular structures that generate and maintain our energy, both in our muscles and in our brain, which may explain the mental edge we often experience after a workout. Studies show that getting the heart rate up enhances neurogenesis, which is the ability to grow new brain cells in adults. So, to summarize, exercise can actually help reduce inflammation in your brain, help your brain's ability to grow new brain cells, increase the creation of cellular structures that contribute to our energy levels, and then it can stimulate the growth of new blood cells in the brain. So just physiologically, your brain is getting incrementally healthier as you are physically active, which that seems like a good thing to keep just the physical matter of our brain healthy. Next, cognitive benefits. The physical effects that exercise can have on the brain that then contribute to cognitive improvements. So things like memory, problem solving, and critical thinking skills. Here's a quote from Harvard Health that says, in a study done at the University of British Columbia, researchers found that regular aerobic exercise, the kind that gets your heart and your sweat glands pumping, appears to boost the size of the hippocampus, which is the brain area involved in verbal memory and learning. So again, the size of that part of your brain that's associated with memory, verbal memory and learning gets boosted with aerobic exercise. So exercise seems to have long-term effects on brain function. Again, we're thinking long-term benefits, not so much the short-term, although it says that you can have a mental edge right after you work out, which to me is kind of a version of a short-term immediate gratification benefit. So exercise has long-term effects. Scientific American conducted a study where they tested people's physical fitness using a treadmill test. And then he did a second treadmill test 20 years later. And using the results comparing of the two tests, they determined that those who were in better shape in 1985 were more likely to be fit 20 years later. And then they went back 5 years after that, and here's the quote. They subjected the participants to a battery of cognitive tests. So they determined that the people who were physically fit retained that physical fitness more 20 years later. So then 5 years after that, they subjected the participants to a battery of cognitive tests assessing memory, processing speed, and executive function, measures of our abilities to learn, reason, and problem solve. We found that the people who were more physically fit in 1985 performed about 10% better on the tests compared with their less fit counterparts. A modest but important difference. The message is clear. For generally healthy people, exercising regularly can enhance brain function over a lifetime and not just after a workout. So again, this is over 25 years that they're assessing people's ability to learn things based on their general level of physical fitness. So I think that's quite interesting. Exercise can also affect cognitive decline, specifically due to dementia and Alzheimer's. I do have a video, but it's like 45 seconds, and I basically wanted you to see the visual proof of this woman who's doing this study, where she's telling you these things herself. But I think for the sake of time, I'm just going to read again some of these quotes. This is from an Alzheimer's Society article. One study found that cognitive decline is almost twice as common among adults who are inactive compared to those who are active. So listen to that, twice as common. It's twice, I guess half as common for people to experience cognitive decline if you're active compared to if you're inactive. And then combining the results of 11 studies show that regular exercise can significantly reduce the risk of developing dementia by about 30%. And for Alzheimer's disease specifically, the risk was reduced by 45%. So that's not just negligible errors in data gathering. That's significant measurable impact. which, yeah, we have to pay attention to. It seems that regular physical activity greatly reduces your chances of getting dementia and Alzheimer's. And these numbers are significant also from the Alzheimer's Society, because more than 6 million Americans are living with Alzheimer's. And by 2050, that number is projected to rise to nearly 13 million. So it will more than double. And 1 in 3 seniors dies with Alzheimer's or another dementia. Alzheimer's kills more than breast cancer and prostate cancer combined. So this is not just like a small, insignificant portion of the population. Any numbers regarding loss of life are significant, but this is like the numbers are indeed significant. And lastly, again, we're just touching on these things. So again, jot down the things that you want to investigate more. There are lots of mental health benefits. Exercise is measured, and many studies have been done that it is meant to improve your mood and your sleep, both of which help with memory and cognitive function, both short-term and long-term. And I'll just share, this isn't so much the brain, this is more like the mind, like the abstract mind. And I guess the mental health kind of bridges the gaps between those two things, because mental health obviously can have, very physiological sources for that. But I would just say in my own life, people ask me, it's because I run fairly regularly, and people are like, so do you like running? If you're a runner, you must like running. And I'm like, well, I don't, I'm like, the action of running is not like wild amounts of fun to me. But one of the things that I've learned is to enjoy other things about running. And a couple of those things, just for me, has been the experience of accomplishment in doing something hard, or the experience of like satisfaction with doing something that I didn't want to do beforehand. And I just think that has tremendous benefits, that if I'm able to do something I don't want to do, or that feels difficult or painful, as silly as going on a run in an afternoon, maybe that can challenge me to do other hard things that I don't want to do, but that are healthy for me in the moment. And that doesn't even have to do with physical exercise. There's lots of hard things that we should do in life that are good for us, but we might not want to do them in the moment. So I just have experienced like, greater internal endurance, and the ability to do hard things because of some of the physical activity I've engaged in. And like along with that, building mental endurance, that you learn to not stop something just because it doesn't feel good in the moment, which I think is associated with maturity. I think all of us in our lives, that's kind of an intangible thing, but I think all of us would say, yes, we want to be people who can push past feelings of pain or discomfort, just like adults should, like, whatever that means to be an adult. But yeah, to be like, oh, I'm not going to stop doing something just because it's hard. And I just think that is a tremendous benefit, even if that's the only thing, that you take away, like, oh, can going out on a 25-minute walk on an afternoon that I do not have the energy to do it, could that have some significant impacts in my life? And I think it can. So before I move on to body, does anybody have any questions or want to log complaint about something that I've said so far? Oh yeah, that's the video. I won't show. Oh no.
Is it going?
It's going.
It's okay. It's on.
There we go.
I will say this, just for a kind of thing we were covering, I think Brenda had this to share, that there's actually a part of the brain that identifies that grows when you overcome something that you're kept back by inertia or difficulty. Like when you really break through and do it, that part of your brain gets stronger, and it becomes easier to do those things that we all find to do sometimes. It's like just take starting to the hard work.
Yeah.
Once you're in it, it's great. It's highly likely once you have your shoes and clothing on and start moving, you're going to finish. It's getting to that thing, I'm leaving now, I'm closing the door, that effect of it. So
yeah, if you, this is free, that if you generally make it through the first like 5 minutes of a workout, I don't know the statistics on it, but you're like 3 times as likely to keep going if you're just able to start. And then if you say after 5 minutes, if I'm not feeling it, then I'll let myself stop. But it's some huge proportion of people that just do 5 minutes of the exercise will continue towards the full 30. So and then yeah, think about all the other things that like just getting started on something, whether it's a task at home, um, or like helping a kid start something that like you can, if you get into it and get over the hurdle of starting the task, then usually you're able to carry through. So any other questions or thoughts? Okay, you can also save questions for the end. There's a special slide that says questions. So that is gonna be your chance to for me to answer all of them. I'm kidding. I don't know all the answers. Okay, so the next thing that we're gonna look, we just did brain, and now this is the exercise benefits for the body. And I'm probably not even going to touch on some of the most classic ones. I'm not going to talk about weight loss. I'm not going to talk about heart disease, although that's a huge one that comes up. I'm going to start with the benefits that you can experience with bone density. So weight bearing, this is from the Orthopedic and Sports Medicine Institute, says that weight bearing exercise has been shown to increase bone density and improve bone health. During weight bearing activity, the muscles and tendons apply tension to the bones, which stimulates the bones to produce more bone tissue. As a result, bones become stronger and more dense, and the risk of osteopenia, osteoporosis, and fractures decreases. And then here's a quote from a Harvard Health article. It says activities that put stress on bones can nudge bone forming cells into action. That stress comes from tugging and pushing on bone that occur during strength training, as well as weight-bearing aerobic exercises like walking or running. The result is stronger, denser bones. So the summary of that is just that weight-bearing physical activity puts unique stress on the bones in a way that encourages bone growth and density, which is pretty significant because lots of Americans deal with either bone weakness or full-on osteoporosis. Is actually a huge number. Next, hormone levels in the body are affected by exercise and benefited by exercise. So exercise has been known to increase, that is either to release or boost hormones like dopamine, serotonin, testosterone, and estrogen. And exercise and estrogen are strongly linked. The sex hormone supports bone health, collagen production in the connective tissues and skin, influences lean mass, and more. However, too much estrogen can increase the risk of injury and decrease physical performance. So there's important to find a balance there. But one study also has linked aerobic exercise to improved estrogen metabolism. Participants also experienced a reduction in body mass and improved cardiovascular fitness, both of which contribute to the proper metabolization of estrogen and other hormones. And then testosterone, known as the male sex hormone, is commonly associated with building muscle in men. However, testosterone is vital for women too. It supports cognition, bone density, muscle tone, and red blood cell production, and helps prevent cardiovascular disease. Lifting weights can help improve testosterone production. But don't worry, they don't have to be heavy. This is according to the article. Any weight, even the weight of a can of soup, can be lifted in the right way to help build muscle mass and increase testosterone levels. And then obviously hormones like serotonin and dopamine give us the good feeling that we have, of course, not just during exercise, but during exercising and after. Many mental health experts tout exercise as a mood booster. While many systems may be at play for our moods to improve after exercise, serotonin and dopamine might be two large contributors. So just this idea that in the body, it's not just, your muscles and your bones that are improving. It's also the production and the boosting of some of these very physical hormones that flow through the body and do all sorts of good things for us. So moving on to the third one, again, I'm just briefly touching on all of these things. And this is one I think is most fascinating, is exercise's effects on cancer. Exercise can suppress and prevent metastasis, and that is tumor growth. Here is a quote. New research shows that bed and rest might not be the best treatment for people suffering from cancer. In fact, the opposite may be true. Researchers have discovered the proteins created by the body when exercise when exercising called myokines, that those can suppress tumor growth and even help actively fight cancerous cells. PhD candidate and research lead Jin Soo Kim said that while myokines could signal cancer cells to grow slower or stop completely, they were unable to kill the cells by themselves. So this is not some sort of like, oh, if you exercise, your cancer gets attacked and killed by these myokines, but they prompt the cancer cells to grow slower or stop growing completely. However, he said myokines can team up with other cells in the blood to actively fight cancer. Myokines in and of themselves don't signal the cells to die, Mr. Kim said, but they do signal our immune cells, that is T cells, to attack and kill the cancer cells. So it seems that these myokines that are produced when you exercise team up with your T cells to actively, oh, I just spit quite a lot, to actively attack and kill cancer cells. And I've also seen evidence of this, not in my own life, but I had a friend who was recently diagnosed with breast cancer, and one of the treatments pre-surgery that her doctor assigned her was regular exercise, because what her doctor said, and take this with a grain of salt, I'm hearing it third party, I'm telling it to you, but that her doctor told her that regularly exercising or increasing your activity levels can actually shrink the size of some cancer growth or tumors before surgery. So my friend was like, yeah, I'm going to walk every day, twice a day. Like, I'm going to do whatever I can to like have this surgery be effective. She was so desperate to be cancer free that she was like, there's nothing I won't do. So she was regularly walking. She was walking with her kids and with her husband so that she didn't have to do it alone. But yeah, it was just really interesting to hear, not just in a research study, but the life of a friend. This was actually being told her by her real life doctor. And then fourth and finally, and this is where I might ask you to weigh in a tiny bit, Dr. Lynn, is that exercise, and this is also the most obvious one, it makes you stronger and can help prevent chronic pain and injury. And so the way that I've been learning a little bit more about this is that there is some new studies going on about like what type of form you should do when you're strength training for your knees, because lots of people complain about chronic knee pain, and that's true. I'm not going to doubt anyone who tells me that they have chronic knee pain. I myself have struggled with chronic knee pain at times, and I've inherited my mom's knees, who just had her first total knee replacement surgery, so there's a very likely chance that I may have the same knees in 40 years. But something that I'm learning is that you can actually do some strength training exercises to take some of the stress off of your knees, which, I mean, I could demonstrate them for you right now. I actually have a link right there to a TikTok, but again, I don't think I'm going to show it to you. But it's basically this guy just demonstrating that, like, hey, if you have knee pain, it actually could be due to weakness in some of the surrounding muscles around your knee, that if, like, for example, your quadriceps are really weak, that's going to put more stress on your knees. Or this muscle right here that flexes when you flex your foot, having a weak one of those is going to significantly reduce stability in the knee. So you can decrease your knee pain depending on the type of knee pain that you have. Again, this is not like going to work for everybody's knee pain. But if you have a strong muscle here and a strong muscle here, that's going to stabilize then your knee so that you're not experiencing as much pain doing things like going up and down stairs, or when you're in the gym doing things like squatting or lunges. So I'm going to put, this is your chance, that do you have any advice on things that you tell patients, strengthening exercises that can actually help improve an experience of chronic pain in the back that you tell people?
So I would say yes, and I'll keep as short as I can. Basically, two things that work there, Lauren. One of them is that there's two types of nerves in your body that have to do with what you sense is happening around you. And there's one that they're called proprioceptors. They're the good ones that give you an idea about where you're at in space. There's nociceptors, which are ones that are giving you a warning about impending damage or inflammation or just things aren't quite right. When you're inactive, the nociceptors talk more loudly. They just do it because the proprioceptors are not being asked to do anything to give you feedback, so they just kind of start turning off. So people who are more sedentary just feel, I think, higher levels of pain at rest than they should, just because they're not moving. And even when they do exercise, they tend to be more sore. Secondarily, most people that I have seen who have come into us who actually have let's say anatomical changes now, like say they've noticed, my doctor says I actually have a loss of space underneath my kneecap, or I have a loss of joint space here. That anatomical change started off as a physiological change first. There was something in their body that was not balanced. They weren't using it symmetrically. There was something that was not lined up properly. They weren't neurologically intact, whatever. And so they continued to play and do different things on those things, almost like a wheel that's out of alignment and now it's starting to show signs of wear and tear. Thankfully, the body's very forgiving, capable of healing, even in some of those situations. And we've seen a lot of people have been told, well, this will have to have surgery, and they've actually not needed it. But they'll do it. So, but you have to be able to work at it. That's the thing. The things that got you, the imbalances or the lack of use or the improper nerve supply that got you in that situation is going to have to be addressed. And we'll just have it on sound. So.
Yeah, thanks. I realized I was asking you to draw on a very deep well of information in a very short amount of time. But so that's why you tell people, like, I'm assuming that you don't just tell people to come in and that just their chiropractic adjustment is going to solve everything. You actually also have them do stretching and strengthening. So that's for you guys to be actually doing the strengthening exercises that Dr. Lynn is telling you to do. He's not just trying to ruin your life. He's actually trying to help you experience less pain and to rebuild some of those things in your body. So I could go on a lot longer. This is already slightly over time, so I will wrap it up by just saying, what are then the recommendations for what counts in order to benefit? And these are the generally accepted numbers, but if you are like looking at this and you're like, there's no way I can go from what I'm doing now to this, just think about incremental steps in the right direction. Don't think about having to do this right away. So the accepted recommendation is that adults need at least 150 minutes of moderate intensity physical activity weekly, or 75 minutes of vigorous intensity activity. It doesn't have to happen in one stretch. For example, moderate intensity activity could be broken up into 30 minutes a day, like you said, 5 days a week, or smaller bouts that add up. So it could be 2 15-minute walks a day, for instance. And then all adults also need muscle strengthening activities 2 or more days a week, according to the CDC. And adults 65 and older need to also incorporate balance activities about 3 days a week. And you can, of course, find more about that because the recommendations are different depending on age. If you're pregnant or breastfeeding, the recommendations are also different. If you're operating with a physical limitation or disability, of course, numbers are different, could be different for that. So here are my very brief ending recommendations or next steps for you if you want something tangible to think through as you try to apply this to your life. The first is just to make a plan in advance and then do your best to stick to your plan. I think if you're waiting for the moment in a day where you have free time and motivation to exercise, that moment is rarely going to come around in life. So the idea of planning ahead of time, I don't know if you plan your weeks on like a Sunday, but to sit down and say, okay, these are the free windows of time that I have throughout the week, and this is how I'm going to get my walks in, or this is how I'm going to make it to the gym, to that group fitness class that I want to do 2 times a week. And there's a lot more studies done out there about the idea of like decision fatigue and how lots of people feel like they're making so many decisions throughout the day that then they come to the decision about whether or not they're going to work out according to their plan, and they're just like, oh, I'm just not going to do it, partially because they've been making so many decisions. But if you make a plan and just decide, I'm not going to decide whether or not I'm going to the gym, I'm making that decision now 4 days in advance. And when you get to that time, no matter how your body's feeling or how your motivation levels are, to do your best to stick to your plan, to make it to the gym or make it out the door. But I'll also say, keep this within reason. Of course, like you don't want to be some sort of militant type person that ignores everything and everybody because you're sticking so hard to your plan. Do this within reason and, stay as flexible and motivated as you can. One trick could be something called habit bundling, which is especially if you're someone that time is quite a barrier for you and you feel like you could resent physical activity for taking something away from you that you want to be doing. So I've learned that you can habit bundle where you take something that you want to do and bundle it with something that you don't feel as motivated to do. For instance, I want to watch TikToks. Am I a 38-year-old person? Yes. do I also still like to watch TikTok? Yes, I do. So I'm like, oh, well, I'll let myself watch as much TikTok as I want if I'm on the treadmill at the gym. And then I can't walk on the treadmill forever, so I have to turn the app off as soon as I get off. But it's a habit bundling thing where I feel motivated that if once I get on the treadmill, I can watch as much TikTok as I want. So whatever that could be for you, yeah, figure out how you could bundle those things. Or maybe it's time with a friend that you plan to go out on a walk. You want to see the friend, and the walk just happens to be part of your time together. You could also do this with two things that you don't want to do, bundling them and knocking them out at the same time. So if you don't like planning your meals for the week or your grocery list, you could do that on the elliptical at the gym, and do it at the same time. You're like, I'm going to get an hour's worth of unpleasantness out of the way in 30 minutes. That could also work for you. I'm biased, but I would say try a group fitness class or a personal trainer. A group fitness class can act like an appointment on your calendar that you can't dismiss quite as easily as just saying, oh, it's just me that's heading to the gym, from 6 to 6:30 today. It's kind of like you're meeting a friend there a little bit. I mean, you can still obviously not show up and, your instructor's not going to be like, where were you today? But it can act more like, okay, I know it's going to start at 5, it's going to end at 5:45, and when I walk out of the gym, I'm going to know I got a good workout and like I pushed myself. And then there's the community aspect of it too. Again, this could be a whole other talk, theoretically, but you could, group fitness or a personal trainer. And personal trainer actually is an appointment. And depending on your finances, like you're investing money above and beyond even what you're paying to go to the gym for that. So you have even more invested in making sure you keep that appointment. Lastly, I would say balance variety and regularity. Like you could get bored really easily. So when you find yourself getting bored, think about mixing it up and doing something different. But if you're just like doing something new all the time, that it also makes it hard to like track progress and see improvement. And so maybe try to find a little bit of regularity there, but don't feel like you're penned into some sort of plan. Do your best. Go back and forth between variety and regularity and routine. And just last, I talked about this at the very beginning, is just to identify and acknowledge barriers that you can see yourself experiencing and be okay with just growing in this area instead of being perfect. Again, you see those recommendations and you could think, this week, if I don't get 150 minutes of physical activity, then I failed. It's like, well, can you get 5 more minutes of physical activity this week than you did last week? Can you get 10 more? Can you lift weights once this month, where last month you didn't do it at all? So again, just look for ways to improve and not be too hard on yourself. Be gracious and patient with yourself, because again, like you said, this could feel like it takes a lot of time in your life. And so, yeah, no one can do it perfectly. No one goes to the gym every time they think they should. And so, yeah, relate with yourself with grace and a lot of patience. And just think about growth and not perfection. Okay, so the time has already passed several minutes ago. So, I mean, people are very free to leave.
What's the QR code? What is that?
So the QR code is, I think, it's either it's the World Health Organization has these like fact sheets that I couldn't figure out how to like print it in a good format. It's also 13 pages long. But if you want a good tight summary of a lot of this, of what I just said, that you just want to peruse on your own, you can just scan it and it'll take you to the website that you can kind of do you can have a one shot of it all in one place.
World Health Organization?
Yes, if I'm remembering
The
correctly.
question is who? Right?
Yeah.
WHO? Just kidding. So,
Whoop.
Laura, that's right. So, Laura, thanks for that. Guys, one thing I want to tell you about exercise is this. 2 things that just popped in my head as Laura's finishing there. One is that perfection is the enemy of progress. So, like she said, if you say, well, I'm going to do this stuff this week, you have it all mapped out, and you only did, say, 3 of the 6 things you planned on that week, did you really fail? If you did 3 more sets of things of exercise than you did that you would have had not planned it, like you would have done 0 big egg on that one, you didn't fail. You just didn't reach the goal you'd set for yourself, maybe as much, but guess what? You didn't get it the next week. But that's the other side of the coin too, is to actually, exercise, chiropractic, all these things we're talking about, you can outsource a lot of things in your life, but I can't exercise for you. I can't eat healthier for you, right? I can even have a meal prep company make them for me, but I have to eat the stuff, right? So most things in life that are really good like that are really like that. They're the things that you have to do for yourself. And again, it may be just a real barrier. Maybe you just felt like I was never good in PE. I never played sports. Well, movement's an essential part of it. It's a nutrient for life, right? So think about ways you can actually do that and enjoy it. And actually, once you get started, it's good. And actually, the sense of accomplishment, and when you see your body changing and the things you can do before, like, hey, I used to just get tired by 8 o'clock. I was always done. Now I'm going to do the whole day, or right, or just fitting into the clothes you wanted to, or whatever it may be. I'll be able to, like, for example, there's one person that we care, and I'll tell you how this goes. This will be my last point. You can combine these things, like Laura said, and make things happen all at once. So somebody we care for is a very busy professional young woman. She's in her first job out of college, very busy. And one of the things we actually need her to do is a set of exercises and traction for home for help her to restore her posture to its best position. I know we're going to fit this in for her life, but she said, I do have a little bit of time, but I also want to watch talk videos or something inspirational or listen to podcasts. I also do something that's beneficial for my gums. I'm going to do some oil pulling for those. And I want to do some red light therapy to help improve my mitochondrial strengthening of that too. She does all four at once. In other words, she is laying on a traction block with the red light shining on her, doing oil pulling and ear pods into the zoo. And that's a very powerful 10 or 15 minutes of her life. Imagine how many neurons she's proliferating in her brain, and new dendrite connections there too. And she crushed it. I mean, literally in the first 2 months of her care, she met virtually every goal she had set for herself. So I share her example anonymously because I just think it's a great example. So you can do that too. Laura's giving me some great strategies for that too. And I think it's great to have some type of reward for yourself when you actually follow through in those things. That's congruent with your goal. In other words, not saying if I finish my workout, I get to go to drive through the fast food, right? Do something that's congruent with your goal. Like I get to go do this or whatever. That's good for you. So Laura, thanks for being here. This is awesome, guys. And also, if they want to see where you teach your classes at Genesis and at the university, tell them how they could meet you there.
Yeah, so I teach one class at Genesis Health Club on Thursday night called Body Pump, which is 6:30 to 7:30, and then the semester is over right now at the Campus Rec Center.
What do you typically teach?
Over the summer, I'm going to teach at noon on Wednesdays, a spin and strength class.
Nice. We do have some people.
It's on campus at the University of Nebraska.
Yeah, the rec center. And we do some people who actually work at the university, so that'd be a possibility if they're members, and I could go do it with you. That's super cool.
Yep.
Okay, Body Pump is a great class. Good one too.
It's like cardio and weightlifting
all in
in
one.
55 minutes.
All in one. Okay.
Yep.
So who feels more educated? Who feels more inspired? Good. Okay. Take that with you tonight. I would encourage you to write down one thing. Just take your one thing. There may be more than one. That's fine. What's the first thing you need to take action on? To post that somewhere on a 3x5 card, on your mirror, as you leave your door of your house, in your car. And do that enough times and flex that muscle until it becomes good. And then you can start adding the other ones in there too, guys. I look forward to seeing the results. For those who are here on Facebook and those who are here, I'm going to ask you some things about how's that going for you, right? Even if you're coming up on a busy time in life, as you are, Mona. I know you're going to do this stuff, which is going to be great, okay? The time to exercise is when you think you have the least time for it. You have to take the break for it, okay? And we're done, guys. Thanks for coming.